Hello, I'm Dr. Sindhu, one of the doctor here today. May I confirm your good name and age, please? Nice to meet you, Mrs. Julie. May I know what brings you here today? Okay. Is there anything else you would like to add? Okay, I'm very sorry to hear about it, Ms. Julie. I totally understand that how painful the situation would be for you. But before we start management of your pain, I would like to ask you a few questions. Okay, and some of them might be very personal and private, but let me reassure you that everything that we discuss will remain confidential between you and me. Okay, is it okay with you? Thank you, Mrs. Julie. So may I know your exact age? 16 years. Okay. When did you had your first period? Like at which age? Okay. When did you had your last period? About 2 days. Okay. Ago. Okay. Any bleeding in between the periods? Are they regular? And what about flow? If it is normal or scanty? Okay. How many days do they last? 3 to 4 days. Okay. And since when painful menstruation? Okay. If there is any association like vomiting, diarrhea, fever, any burning curation. How about your bowel habits? Any diarrhea, constipation? Okay. If you are married, okay. Okay. Messima. Do you ever been to gynecologist? No. Okay. Do you have any past surgical history? No. Okay. Any discharge from your front passage? If there is any family history of similar symptoms, painful periods, your mother had. Okay, I'll ask you a few more questions, Mrs. Julie. Okay, do you smoke? Do you have any high blood sugar, high blood pressure? How's things at home? And that's great. And what do you do for living? Okay, student. Okay, and how's your mood? How about your sleep? Do you like to exercise? Okay. Are you taking any medicine prescribed by doctor or over the counter? Do you have any allergies? Any allergy to medicine? Okay, Mrs. Julie. What worries you most in particular? Can you elaborate? Okay, and what do you expect to gain from today's consultation? Okay, I really appreciate, Mrs. Julie, that you are concerned about your health. Okay, and let me reassure you that you seems to be healthy otherwise except pain during first 1 or 2 days of your period. Okay, so I'm going to skip the examination. Okay, except I would like to examine your back for any tenderness or obvious hump. Is it okay with you? Thank you, Mrs. Julie. And then I'll sanitize and check a back for any tenderness, any obvious lump, any scar formation, and okay, Mrs. Julie, in order to confirm my diagnosis, I need to perform certain tests. Is it okay with you? Okay, I'll offer you abdominal and pelvic ultrasound. Okay. And let me reassure you, Mrs. Julie, that what I have gathered from the information you shared with me, most probably you have a condition what we call in a medical terminology is as a primary dysmenorrhea. Okay. Okay. Yeah. Okay, and this is not a serious condition. Okay, pain occurs 6 months to 1 year after start of period because ovaries start producing eggs. Okay, and pain occurs when a womb secretes or contracts and its blood supplies decrease and pain occurs. Okay, but you need not to be worried. Okay. And I'll offer you some pharmacological management and pharmacological management. I'll ask you to follow some lifestyle changes. And so take plenty of fluids and do regular exercises and try to be happy. Okay. And when in pain, take warm bath and sit in warm tub for a while. And you can put hot water bottle over lower tummy and squeeze it between legs and tummy. And all these changes help to decrease pain, I hope. Okay, is everything clear to you? Can I repeat again? Okay, so here is a tablet. I offer you a tablet mefenic acid. It is 5 mg. You have to take 3 times a day. Okay, and start taking medicine when periods starts. Okay, and if not only decreases, and it not only decreases pain but also amount of blood clots. Okay, and if you have, do you have any stomach problem? No. Okay, if you had, then I could prescribe you omeprazole tablet along with mefenic acid. Okay, but yeah, and Mrs. Julie, please visit me as soon as reports of your ultrasounds are available. Okay, and CBC and thyroid profile. Okay, and I hope the prescribed medicine will solve your problem. But if your pain becomes severe or continues beyond first 1 or 2 days of periods, then please seek immediate medical help. Okay, and here is my card. You can contact me as well. Okay, is there anything else you want to discuss with me today? Can I repeat all, summarize all for you? Okay, so first we talk about your symptoms. Okay, and secondly about your family history. Okay, then we performed examination. Okay, and fourthly about investigation, and fifthly about management. Okay, and sixthly about lifestyle, and then about pharmacological. I talked about mefenic acid. Okay, and then I ask you to visit me as soon as possible when your reports will be available. Is everything clear to you till now? Okay, here is a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. Okay, is there anything else you like to add or discuss with me today? Okay, thank you, Mrs. Julie, for your cooperation. I wish you a speedy recovery. Take good care of yourself. Bye-bye.